Oh, wow.
Yeah.
How's the payroll stuff going?
We've got a Zoom.
I hear you're doing a good job.
Well, I mean, it's so jacked up.
I don't think you just have to
I know.
sign on, it's just
You
a.
can just go in and do something and it looks like you're doing a good job, so. Anything's better than me. Oh my gosh, I just,
So,
I said it 100 times, and like,
I like playing.
I feel bad for all the like, under the breath, that I gave as a timekeeper, knowing what happens on that side now. So.
Yeah. I know, it just seems like there could be more solutions, but I don't know. I don't do the payroll, but from what I hear, it's it's maddening.
That's Tammy.
Hi
This is
Tammy,
hello.
nice to finally
Yeah,
meet
she
you.
is well.
Hey Karen,
No, it's all
this is Steve at the IUC. Can you hear us?
On that arm.
I finished it finally, so
Oh my gosh.
it all,
Hey Karen, this is Steve at the IUC. Can you hear us?
Daughter?
the time she was born. And how
Can you hear us, Karen?
in my life, and kind of
Wow.
first up, and then it goes
Oh
all
my
the way.
gosh.
Wow, that's good.
How long did it take?
About 30 hours.
Really? So just a little bit of.
Sorry, Karen, one more time, Karen.
15 months. So between healing.
Can you hear us here?
Colorful.
Thank you.
Okay.
That's something I wanted and sound so
Mine.
good.
Yeah. Looks like a sleeve on the.
Sir, I have a quick question. Yeah, we'll turn 26 in March. So you need to get done insurance starting with this
Yeah,
open
they have
enrollment.
to come off
here,
the
too, so we
end of
can
the month
change-
in which they turn
If for some
26.
reason we gotta change the camera angle or
So
something.
you're better off just
He's
signing.
on your plan as
Yeah.
dependent.
That's
Yeah,
a little
she is.
different.
We do offer Cobra for 18 months, but you have to pay the, you have to pay the.
Oh, okay.
He knows 35 years.
yeah, he was worried about it.
He what?
He works here at the city.
Oh.
He's a police officer with us.
Okay, let's see. Tell me his name.
Nicholas Dorman.
Okay, that's right, I'm sorry.
That's all right.
Oh, yeah.
Okay, so,
Yeah.
he can go on to our ESS self-service portal and request a life change plan. The only thing is you have to put some kind of document with that as evidence, so,
Per member, per month.
Certificate.
So employee versus
yeah, he can.
any member,
he just
any member, yeah.
He's employed here, I know,
He could just.
but
he
if
could
you have
just-
to attach something.
He could just sign up for open enrollment.
Yeah.
What? Man?
You're the one who asked for all that.
So
I know.
you
That's
wanna,
what's
you're
sad.
gonna take him off your plan then for
Might
January 1?
Might as well. Only 3 months.
Okay,
Or
so
down?
he'll just, yeah, he can go on open enrollment.
Yeah, he and I were talking last night. I told him.
Later.
And then you'll need to go in and take them off of
Yeah.
yours.
Yep.
Okay, that'll work.
Thank you.
Okay, we'll go ahead and get started. Good morning, everyone. Thank you very much for coming in this morning. To the members that are here in person, welcome back. It's been a long time since one. So we don't have any feedback from trying to do in-person and virtual. If anybody on the Teams meeting, if you could kind of raise your hand or wave or get somebody's attention, we can turn the speakers on, conduct any official business. Now, for the people that weren't there to watch it, I assure you that there was no official business conducted that day. There were some presentations that were given. I talked to the city clerk's office along with some of the city admin to make sure that we clear that up. We are going to go over and cover that same information today. If you look under the agenda in old business, there'll be a presentation from Lockton on the reforecast and the projections from the September claims, and then under new business will be the Cigna update on the dental premiums. We will reiterate and go over that information again today. So for our first item on the agenda is going to be the September 23rd meeting minutes. Those were distributed. Hope everybody had enough time to look over them. If you have any questions, comments, or see anything that need to be changed, we can get that done.
I'll make a motion to accept the minutes.
Second.
Motion. All in favor, say aye. Aye. Motion approved. Cigna, is Lisa Phillips on? Or even Julie. Julie might be able to help us out.
We've had individuals diagnosed, and
Okay. Thank you, Julie. And my apologies, I missed over finance So, is Kimberly on?
Yes, I am.
Good morning, Kimberly.
Good morning. I emailed out the financial report for September. The OAP plan had a net income of $43,776. And the OAP2 plan had a net income of $65,916 for the month of September. For the fiscal year, the fund is experiencing a $1,154,245 loss. And the ending net assets are $2,221,358. We did receive the second quarter prescription rebate for $245,000, and I have updated the IBNR through September that was provided by Lofton. So on the bottom of the financial statement, it went down slightly from what it was at the end of June. It went down 53,000, so there's the increase in the IBNR that we've listed. Does anyone have any specific questions? If not, I guess I'm good.
I'll make a motion to accept the financial report.
Mike Laver makes a motion
Second.
to accept the financial report from Kimberly. It was seconded by Jamie Franklin. All in favor, say aye.
Aye.
Anybody opposed? Oh. I guess I have to use that. Next item on our agenda will be locked in. Is Amber or Dina on?
Did you guys get copies of the material that we had shipped to you, Mike?
Yes, I got that Monday and it was passed out to the members here in person this morning. Thank you very much for that.
Super duper. Okay, great. Well, I know last week during the special Stay-Well committee, we talked a little bit about how the plan was running, and that September, thank goodness, was more favorable than August. So total plan costs for the month of September were about $1.3 million. On a PEPM basis, that's $1,145. So year to date, we're looking at a deficit when you compare total plan cost to funding of $1.6 million. As we have been doing this year, just with the removal of the post-65, we've been looking at the numbers not only on a per employee basis, but a per member basis. So year to date, the per member per month is $589. This time last year, it was $493 per member per month. And then if you want to go ahead and flip to the last page of the report, the large payment, we now, for the month of September, have a total of 13 members with claims over $150,000. You'll notice that there were 2 additional for the recent month. And we've got a total overspec of just shy of $15,000 for year to date. And then footnote, there's 11 members who are between that 100 and 149, just shy of 150 threshold. So we've got 11 more that are on the quote unquote horizon, if you will.
Amber, do you have the numbers where we could see, I know we've talked about it the last couple of months of our claims that have been under the $100,000 mark, and we've had a numerous increase of that. Has there been an increase over the last month or so, or are we still holding?
Let me see if I can take a look. And Dina, if you happen to have that up, obviously chime in, but I can pull that up while we're. Mike, that might have to be, unless one of us can get to it quickly, that might be a follow-up, just in the interest of time.
Okay.
Actually, I do have it.
Well, you do have it. Of course you do.
Right now, I have it broken down into active and the pre-65 retirees. Right now, there are, I have it 79 above 25,000 that are active and 36 above 25,000 for pre-65 retirees. And the total plan spend there through September is 8.3 million. If you look at over 50,000, there's a total of 35 active, 23 pre-65 for 58 individuals, and they are 6.3 million. If you look at over 100, so obviously some of these people are dropping off each time, but some are the same people. There are 17 active and 7 retirees for right at $4 million. And then you obviously have 150,000 on the stop loss report. For all of 2019, for comparison purposes, there was 81 actives over 25,000, 41 over 35,000, and 15 over 100,000. But the retirees numbers are 44, 20, and 9. So you are charting a little bit above last year in the terms of frequency for sure.
Thank you, Dina.
Thank you. Does anybody have any questions over the Lockton report? We have a motion by Mike Labor. All in favor, say aye.
Aye.
Anybody opposed? Motion approved. Next will be an update from HR, either Terry or Jennifer.
Just open enrollment started on Monday, the 26th, and everything is online for the active employees, going on to the employee self-service portal, and the materials were distributed. Thank you. The materials were distributed through email. Most people have a city email address, and we mailed packets to those people that did not have a city email. So it's going well.
Okay. Thank you. Next order of business will be wellness, and it'll be Selena.
Hi, I'm here. We have quite a few things going on besides, like Terry said, the open enrollment. I'm way less involved in that now, but just sending out our emails every Wednesday. I did update that. I made sure everybody is reminded that the open enrollment is going on currently. We are also I'm working with Terry to get 2 seminars the rest of this year through our EAP system for lunch and learns for the employees sometime in November or December. We also have another blood drive coming up in November. The last blood drive went pretty well. We've been in the 40s recently, and I think this was closer to the 30s, but maybe just because there's not a lot of people on site, we might get back up into the 40s again in November. I think we're going to use the Uptown Market if we can. That's a good location. A lot of people really like that location, so that might help out. So that'll be in November. I don't know if any of the employees have said anything or have noticed, but we've been doing the past 2 months, we've actually been delivering breakfast, fruits, and snacks to different departments there at the city. We started in September, and then we did October. We'll do November and December, and everything from what I have been hearing is all positive. Actually, they want more. The police, when we dropped them off last week or 2 weeks ago, the police told me that the next day there was just a few apples that were left over, just one day. So people are really enjoying the fresh fruit and all the snacks that we're providing to them. So I think that's a great benefit. We're going to continue doing that. Maybe looking into next year doing it every 2 weeks if we can. We're partnering with Hy-Vee. They've been a great partner to help deliver those to us. It's just a matter of now we don't know how many people are on site. Every day it changes and what businesses are open or what departments are open. So that's been a little bit of a challenge, but I think it's been going really well for the people that are on site. We're also working with departments as well to find out if there's any fitness equipment needs that any of the departments might need, like maybe some standing desks. If there is a group of people that are always sitting down, but they had a standing desk or two, maybe they could take turns using the standing desk or a walking desk or something like that in their department. So they'll get up off their feet and rather than sitting down, 8 hours, 10 hours during the day. And then we're also working on a needs assessment to go out to all the members. So that's currently what we're doing in wellness. You've seen some of it. We've been doing the Wellness Wednesdays with Chase's providing a update or a spotlight, I guess, on some of the classes that we offer free to the employees. So we've been sending that out as well.
I'll touch on it real quick, Selena. I know our biometric screenings are still open through Quest Diagnostic through the end of the year. I encourage everybody to get out and do that. And as a reminder, last year we did flu shots at open enrollment when we had the benefit fairs. We were unable to do that this year because of the restrictions. So I would encourage people to see their doctors. Or you can go to CVS, Walgreens, those types of places, and the Hy-Vee clinics, which are now up and running through the Cigna plan as well. Those are all considered preventative measures, so there's no cost to the members at that time up front. It's all included in the plan, paid 100%.
Right, and the one thing too with the biometric screenings is we have that cool partnership with Quest, and that's actually been going really well. Encouraging people to just go on to a Quest location, sign up. It is a fasting a fasting biometric screening, so make sure you probably want to do it early morning time. Just it's real easy through Quest. I'm not saying it's not as easy through your primary doctor, but a lot of times when you go through your primary and you want to get your biometric screening, you have to be very, you have to make sure that the doctors know that's exactly what you want and that's what you're looking for. So the Quest has, the employees, from what I've heard from people, they've really enjoyed the partnership with Quest as far as biometric screening has gone, and it's gone really easy. So that's something that if any employees have any questions about how can I get my biometric screening, where can I get it done, the Quest, I keep sending out emails. They're in all of our Wellness Wednesday emails, but I can send out more as far as that goes because it does go until the end of December. So.
Mike, do we know, are all the facilities available for the city employees at the Quest Diagnostics and the Hy-Vees in the whole metropolitan area?
I'm not sure about the Quest. I know that when the flyer came out from HR and Cigna in the joint effort, that there was a list on there. There was 13 different Hy-Vee clinics scattered throughout the entire metro. I believe both Independence locations were on there. There were some, I believe, in Lee Summit. It stretched all the way out to Johnson County, Kansas, up towards Liberty. So it really did a good job of spreading out and hoping we can touch and reach all of our employees and members that are on the plan, because as we know, not everybody lives close to the city here in Independence. So that was one of the reasons.
Right, and the Hy-Vees do not do the biometric screening. The Quest do. And when I sent that email out, it has a location finder, so you can put in, I live in Blue Springs, so you can put in your zip code, and it'll show you the closest one to you. For as far as the biometric screening goes. But like Mike was saying, for a flu shot, you could go to, yes, both the Hy-Vees and Independence are on there. I think the Blue Springs one, there's a lot that are around a lot of our employees that you could go get your flu shot done. You can also go to a CVS. You could also go to your primary doctor for a flu shot as well.
I did have a couple of requests from employees about the Hy-Vee clinics. They were wondering if we could have a location, the Hy-Vee in Blue Springs is not on that list. So I said I would bring it up. I don't know how Cigna chose those Hy-Vee clinics, but we do have quite a few people that live in Blue Springs. So I thought I would bring it up.
And just to speak about how they were identified, we looked at the membership listing at the time and where we had the city had the biggest populations. That was how we chose the specific Hy-Vees. So we can definitely look at whether we can add Blue Springs. That's something that the city wants to do.
I think it's something to look into, and maybe we reevaluate that at next month's meeting. Kind of see if there's any additional cost to that, and kind of go from there. If we do have employees, I live in Blue Springs as well, so that's the Hy-Vee that I use. So that might be beneficial not only to a lot of employees as well. So it's something to look at, and if that's Julie, if that's something we could look at for next month's meeting, I'd appreciate it.
Will do.
Thank you. Selena, do you have anything else?
We are working up in the finance department right now. We're working really hard on sending out some wellness boxes to all the employees. You can outsource this to be done to another company, but the things that we've heard from doing this wellness boxes, we haven't really heard really good things about it. So we just decided to go ahead and take it on ourselves. So we are currently purchasing wellness related things that we're going to box up and or envelope up and send out to all of our employees that are currently working for the City of Independence as a thank you. And we appreciate you, and some of it's safety stuff, so say, some sanitizer, things like that. Everybody loves the Cigna pins. Those will be in there. Nobody wants to share their Cigna pins. So just some wellness things that we're going to send out to the employees that we are currently working on. We have all those stuff right now up in the HR department. We just now need to basically get it together, package it up, and get it sent out. But yeah, so that's a big one.
Well, thank you, Selena. We'll continue on to old business. Lockton, if Amber or Dina are still on here, the presentation of reforecast and projections. If you remember back in our September meeting, we kind of tabled this idea or this presentation because we wanted to see another month's worth of claims data. We've got hit pretty hard in the month of August, so we kind of wanted to see September and look at the projections and the reforecast for 2021 again. So Lockton was kind enough to update their studies, and I'll let Amber and Dina take over and talk about that.
Okay, so hopefully you have the materials in front of you. It's the reforecast projections and plan options from October 22nd, 2020. Basically, we did update the reforecast and the plan projections. We do it two ways. One is using claims through March, and one is using claims through September. The reason we use claims through March is because we feel like then we have a valid history that we can use to move forward, project forward. Claims through September will include April, May, and June, which we feel like some of those months were not typical months due to people deferring or avoiding care. In both the projections, we do add a COVID adjustment. Obviously, the pandemic is the first time we've been through it, and our actuaries are relatively conservative, but want to make sure that they are accounting for that COVID adjustment. If we look at claims through March, we were right on target, 1.3% of funding. And if we look at claims through September, and this is the 2020 reforecast, We're about 11.5% below our claims. We anticipate that 2020 will end up 11.5% above the funding levels. So this goes back to our earlier discussion of the number of large claimants that have not yet hit specific and likely will not hit specific, but are growing over time that we provided earlier in our reporting. So what we're seeing is not a bunch of large claimants, but a bunch of claims between that 25,000 and 275,000 range. Moving forward to the next page, we did the same thing. We project 2021 using claims through March and claims through September. Again, there are COVID adjustments, and we know that it's an odd year, so we feel like this is a range of potential costs for 2021. These costs do include a 50% increase to stop loss, which we will discuss later. That is a firm renewal offer from Cigna. It's lower than our initial, what we projected it would be. But in any event, using claims to March, we are recommending an increase to funding of 14.5%. And using claims through September, we're recommending an increase to funding of 19.2%. We think the plan cost will be somewhere between $20 million and $21 million for 2021. We did include in this projection estimates of savings from the prescription drug programs that the city would implement at the last day loan meeting. So those projections are directly from Cigna based on estimated savings by implementing the prescription drug programs. The next page shows a reforecast for the fiscal year looking at July 2020 through June 2021. For the fiscal year, we think that the total planned costs are going to be $20,266,000. Funding is, if it's at the current rate, this is $17,572,000, so there'll be a $2.7 million deficit. One of the questions that came up in the September meeting was the impact of closing the clinic and what that did to primary care. So the impact of moving 2,400 visits, which is about how many have moved to the sector, is about $348,000. The closing of the clinic saved around just over $1 million, I believe. So that's about $700,000 to your bottom line in a good way. So the closing of the clinic has saved about $700,000. We do see that preventive care utilization. We don't have 2020 information yet, but that's the things that we will want to look at as we move forward, is to make sure that we're still getting preventive care utilization, well visits, and primary visits. Pages 6 and 7 are some options on plan changes that you can use to help offset the increased costs. We focused on deductible and out-of-pockets on these two pages because those are going to drive the most cost savings. As you can see, the higher you increase the deductible and the out-of-pocket, the more cost savings there is. These are just out there for discussion, so I won't spend any time going through it. You can see the from and the to column and then the savings on both those plans. On OAP2, currently just one additional comment. Right now, it is a non-embedded deductible or an aggregate deductible. So if you have anything other than employee coverage, the full $3,000 deductible must be met before the plan starts paying any of the costs. This is part of the design that's required by the IRS. When you get to when you get to 2,800, you can make that an embedded deductible, which is similar to what the OAP1 plan is. So that when you get to 2,800, it can cap out the individual at 2,800 within the family. So there's some companies that go directly to that, others still keep with the lower deductible. The 1,500 is the minimum deductible to allow it to be a high deductible healthcare plan that's qualified by the IRS and allows for HSA contributions. but just a couple of notes on that page. And then the last page is just, kind of what the pricing would look like if you took the current rates and increased them 19%, for OAP one and OAP two. Are there any questions I can answer?
Dina, just to verify, clinic costs have been removed from all of these projections, correct?
I'm sorry, Cindy, I didn't hear the question.
Clinic costs have been removed from all of these projections.
Yes, absolutely.
And just so everybody's aware, kind of a refresher of what happened last Wednesday, this was the presentation that Lockton presented to the committee in the special meeting that we had. When you get to the plan options on pages 6 and 7, where we started talking about deductibles and out-of-pocket maxes, there was a conversation about that, and that yes, we would see our most savings in those plans, but there was a long discussion with us already being in open enrollment, being close to the first of the year, that may not possibly be an option because Cigna would not be able to get that done in time to get all the new information out to everybody. And the other thing too is that with us being active in open enrollment, having a hard time communicating that and getting all that information out to everybody at that time. So that's something that we've talked about. Cindy and I met with city administration on Monday, and it's something that we've been tasked with as a committee to continually monitor this plan like we have been. But as we progress through this COVID pandemic and we start seeing actual hard fact numbers that come in, that may be something this committee's tasked with making some changes. Not only to premiums, but also to our plan as a whole to maintain the health of it. So. Some of the other numbers that I asked Lockton for, just to kind of get an idea. We're getting down to the crunch time of looking at something to do to help stop the bleed on this plan. As you know, August was a really hard month for us. It was over $2 million in claims. September came back a little bit. It was still 1.3 million in claims, which is getting closer to our normal per se, but I did have Lockton run some numbers as far as assuming like a 5% increase to premiums, 7%, a 10%, and all the way up to a 20%. Now, everybody understands that the 80-20 split, the city pays their 80% and employees pay their 20%. So and you have to remember too that when you look at these numbers, our plan year runs from January 1 to December 31st. So we follow the calendar year, whereas the city budget follows a fiscal calendar from July 1 to June 30th. So when we look at these numbers, especially for the city's portion, that would be from, if we did and implemented a premium increase from January 1 to June 30th. So you have to take that number in half. So for instance, if we did a 5% increase over 2021, we would see a city increase of $703,000, and then member in cost would be $173,000 total. Now, like I said, we have to look at these in the different plan years. So in reality, there would be about a $350,000 cost to the city to implement that. When you start looking at the actual plan premiums, if you look at a family plan on OAP one, it would be an increase of about $21 a month. On OAP two, it would be an increase of about $16 a month. So I give you those numbers to kind of give you an idea of what we're looking at. So, and kind of what path that this committee wants to go down to make a recommendation to the city manager's office and how we want to direct this. And, you know, we had a very positive meeting with them on Monday. They're encouraged by what we're trying to do in the afternoon to discuss whatever comes out of committee today and figure out what's going to be the best direction for this plan for everybody involved. That's something that we've always tried to do. I know we all represent specific groups, but our goal is to make sure that we have a health insurance plan and that we have a healthy and a well-run health insurance plan. So I'll open it up and I'll leave that for you to have some discussion and see where we want to go as a committee. And Cindy, if you have anything to add from.
Okay. Well, I think, you know, we were kind of going down that path of trying to get them to do a 5% increase so that we're not at what Lockton projected, that we'd only have like 600,000 left in reserves when we kind of got the meeting halted. It's my belief we still need to go down the path of doing some sort of, it's not gonna get any better if we wait to do something in July. I mean, we're still gonna have to take an increase of some sort. So, like Mike said, I think we're trying to be conservative about it, but look at something to stop the bleed before we hit next fiscal year. That's my belief on it.
I think that happens every year. I think it's when we start messing with the deductible and the out-of-pocket max is when we're gonna ruffle feathers. I don't think we need to increase, 19%. I think that would really be a dagger to the heart, but I think that increases on the premiums are the route we need to take.
And I agree with you. It's something that nobody likes. Everybody understands the year that we've had and gone through, and it hits everybody in the pocketbook. And I agree with you. It's easier to swallow a small premium increase of around 5% versus the full on 19 or 20%. But at the same time, when you do have to utilize your health insurance and you see those increased costs in your deductibles and your out-of-pocket maxes, I know that's a lot of the people that I've talked to would rather see it spaced out over their premiums versus increasing those out-of-pocket maxes and those deductibles. So.
And I'm glad you said that, because we were telling city management that it's hard on the employees, because it's when you get in and you have something major happen, then the employees are struggling to try to figure out how they're going to get the money.
Is on your 20%. The $21 sounds a lot better than hearing 5%. If you're paying $150 a month, and you're going to have to pay $21 more. That's easier to hear, I think, than when we talk percentages. I think a lot of people are just not wanting to hear it that way. Seeing the same kind of scenario for our claims of staying under the reinsurance amounts for the rest of the year and next year. I didn't get that kind of answered in Dina's projections. Are they talking that we're probably in for more months like September?
Yeah,
And having,
Mike, there's no way that we can predict that.
but hasn't over the last 3 years kind of predicted that a little bit, Dina? Because I remember when we were lucky to have 5 large claims a year. And now we're consistently hitting the 12 to 17 range. And I think, what was it this last time you just said we have 18 and we have multiple under the 150 and under the 100? All of those kind of claims are costing the
Well,
plan.
they're always gonna have more under 100 and under 150, because, and as they get larger and larger, it's gonna make a difference. We just received a clinical analysis this morning from our stop loss team. So I can kind of tell you what their expectation is for 2022, but yes, you're gonna continue to see a lot of claims under specific, because that's kind of the spot where most people are. Unfortunately, healthcare costs are going up, so what costs $1 today is gonna cost $1.07 tomorrow, if not more. Obviously, you're trying to do a lot of wellness programming to help control chronic conditions, and that will go towards saving money and lowering those claims, but some things are unavoidable, and that 25 to 150,000 is not an uncommon amount for some significant procedures. Julie, you're welcome to jump in here as well, with thoughts from the Cigna side.
Yeah, I mean, it's definitely difficult to predict, but like Dina said, everything's going up, so, nothing is cheap, and I think, the population, you've got some, aging going on within portions of the population, which means you've got more, expensive conditions that are popping in, and so it's difficult to predict, but, there are definitely some significant numbers coming in, so we don't have a crystal ball. Hopefully it will look better, but we really don't know.
Well, can you ladies tell me, in the last 5 years, haven't our average age for the use of the plan, hasn't it went down? I mean, you guys talked about the older population, so to speak, within the employees, but I thought here just 4 or 5 years ago it was like 44 or 45. Has that not gone down in the last 5 years?
It has gone down. I think though you're still seeing some increased with the older population. You're seeing increased costs and conditions coming in. So it's going to take a little while for some of that to work through itself. And you all don't have significant turnover like a lot of industries do. So it's not something, over time you're going to get younger, but it's not going to be a quick thing.
Okay, one other question on the increase on the city and the employee costs is, are we really going to see the 730 or the 173 approximations in the first 6 months, or is that for the year, so we're only really seeing half of that savings or the increase?
You're really only going to see half of that because
of the fiscal year.
Because of the way the city's fiscal year's timed out and the way our plan year is timed out. And that's why we mentioned earlier is that, as we progress in the next few months and we get into 2021, that this committee is going to be tasked with looking at, how our plan's running. And we may be back in this situation with a little bit more time on our hands to a mid-year plan change or something else. But at that point, we'll have a little bit more data and we'll have a little bit better understanding of what we really need to do to sustain this plan.
How can we do a mid-year, we can't do deductibles, can we?
Yes, we can.
Yeah.
So if you're below it, it would just go on up, and what if you've already went over?
I mean, it's hard to do mid-year deductible change, but it's possible.
But if you had went over deductible and the plan started paying, then does that person owe?
You're talking like if they got there and then 2 months later, oh man, I thought I met my
$1,000
Yeah.
and they've had $1,500, and do they now owe $500 if it went up to $1,500? I don't
That
know,
would be,
that's
and
my
that,
question.
and
All right, experts, tell us.
that would be something we'll really have to look into, and, that is gonna have to weigh on the decision of this committee is, how that's gonna work, and as we progress forward, we've done mid-year plan changes like that before, and I know it's been rough on this committee, it's been rough on Sigmund.
Premiums usually, it seems like.
It's usually.
It's usually premiums,
Yeah.
so I don't think we've really ever
He's
messed
trying
with.
to claw back the deductible.
Which even if we did mid-year, my thoughts was when we were meeting with the city, I kind of felt the same way. Even if we did this increase right now, and then we had to do mid-year, we're probably still looking at more of an increase, Jamie, and then if we had to do the deductible change hit January, but we would be in the fiscal year to where we'd know where we were gonna kind of come out, as opposed to the calendar year. But right now, we're just trying to influx some cash into the plan.
No, I agree with that. Dean, I had a question on the stop loss and the large claimants. I'm guessing our stop loss limit has not went up the same percentage as cost of healthcare. So we're gonna keep seeing more and more numbers. Would that be right?
Yeah, last year was the first year in a long time that you actually raised your specific limit, and it went from, 250 to 275. So yeah, that's leverage trend is what that's called. But it's all a risk reward situation. So if you increase your specific annually with the cost of healthcare, then you can save a little bit on the premiums, but you're picking it up in the claims. So if everything went up at the same rate, that would be ideal, but obviously that's not the world that we live in. Healthcare costs go up much faster than other costs of living, and have for as long as I've been in this business. We keep saying it can't happen, but it does. And the risk reward piece is always something that we evaluate. So we do have stop loss marketing with that risk reward evaluation in it, ready to present today as well.
That's not gonna help though. Okay, I'm just gonna say, it's not gonna help when we've got all of these above right at the 25,000. And
correct.
And that's what's killing our plan right now, is all of these that are above, that are right at the 25,000 to 50,000 mark. And when you guys did the evaluation of that data, and I know you said there were 79 actives and 36 pre-65s. Can you tell, are those are those surgeries? Kind of elective surgeries? Is that what's falling into that? I mean, because we know so many people put off doing their procedures at the first of the year. Did you guys look at that data at all to see what was causing those claims in that kind of range?
It's all over the board.
Yeah, we can pull that up. Julie, I think you had it at your fingertips last meeting.
Yeah, and it's, it's all over the board where, there's some surgeries, just kind of looking through the list. There's some surgeries, there's some, if you even go up to like 50,000, there's some other chronic anemia. We can't necessarily say it's all elective stuff that people are doing, because that's not the case. Yeah, like, Crohn's disease and heart, just, like I said, it's all over the board.
Is quite a bit of that, I mean, when you're talking rheumatology, arthritis and Crohn's and stuff, is a lot of that in the prescription drug side of it? Or is this strictly in the medical side?
We've got in total in large claims for this month, RX is about $2 million, and then $6.3 million is medical.
Okay.
We wish we had better news.
No, you said that you're seeing that in all your clients though. It's not just us, correct?
Yeah.
I would like to reiterate too, last year we had to do a premium increase, and that was the first premium increase we'd had to do in like 5 years. We've been very fortunate up to this point, and I think that what this committee's done is trying to stay on top of things has been extremely good. And unfortunately, you go to the private industry, you're looking at anywhere from 12 to 15 to 20% increases across the board, not only on your medical side, but your pharmacy side. It finally just caught up to us. And, I think there's some things that we can do over the next few months and the 6 months or so to kind of stop this and kind of get back to where we need to be. But the main thing right now is that we need something to stop the bleed on this plan and sustain it until we can get to that point. We can continue to look at the data as it comes in. We can work with our consultants and our experts at Cigna and Lockton and move down that path of sustaining this plan.
Mike, I had a couple comments. I've been talking to a lot of our members, and I think a lot of this is education, just like you said a minute ago. I mean, we went 5 years with no premium increase, and that's what you have to remind them is you went 5 years with no premium increase, then you had a small one, and all you're talking about, the problem is people don't understand. When you say a 5% increase, they equate that to 5% of their salary. They don't equate it. So many people aren't educated, and they don't equate that to 5% of your premium cost. Again, that's what I've been telling people for the last couple of weeks is you're talking $20, and that's what you're talking about is $20. And if you want to have a health insurance plan, that's where we got to have it. I think at all costs we need to stay away from a deductible increase. That's the one that hits people in the pocketbook. That's one that hits them the hardest. Nobody wants their costs to go up, but it's a lot easier to swallow $20, $25 a month, $28 a month, even if we did a 7% increase. A lot easier to swallow that than it is to swallow taking that deductible up. We were talking about an additional 1,000, additional 1,500, additional 3,000 out of pocket. That's the stuff that people get infuriated about.
Well, Terry, you hit on a very good point of that communication piece is, it's our responsibility to take back to our represented groups and explain to them what's going on. I know when you get that open enrollment packet, if you don't understand health insurance and look at it, and it's nobody's fault, but it's confusing. Health insurance is very confusing. There's so many ins and outs of it that a lot of people just don't understand.
They're not an actuary. They don't understand it at all.
Yeah, you're right. And it takes a lot of increase, but if you look at it, we could jump up and look at a 7% increase for a family plan.
It's $27, $28 a month.
Yeah, the numbers locked and ran on OP1 would be about $29.
Yeah, and that, again, people don't equate it like that. They hear 5% or 7%, and they say, well, I only got a 1% raise last year, or I got a 0. That's not relevant. It's not, you're talking apples and oranges. It's totally different.
And it is very hard when you look at it and realize that there are some financial burdens on everybody that's on this plan because we haven't had raises. The economy is what it is, and we're trying to maintain this plan. But the other thing too is that, and I think somebody said it earlier, if we don't do something, there's a potential that we won't have a health insurance plan at all.
Premium increase is the only logical solution. Stay away from deductibles and just go down that path. It's easier to sell. It's easier for people to understand, and it's easier on the pocketbook.
If memory serves me right, didn't we do the premium increase at the middle of the year and not at the 1st of January this last year?
We did 2 of them. We had one on January 1st.
July 1st was 4%, and then January 1 was another 4%.
So then it was last year that we didn't have the initial, where the city said that they didn't have the money to do the premium increase? Am I not remembering right?
Didn't have a budget.
How is the city receptive to us doing the premium increase?
I know when Cindy and I sat down with city administration on Monday, they were very open to looking at this. We tossed around a few options that they were looking at, things that they could possibly do. I'll let you know that Cindy and I are supposed to meet with them later this afternoon as well to discuss the recommendation that comes out of this committee to figure out what we can do. So they were open to it. We kicked around a few ideas, and they kind of wanted to see where the committee wanted to steer this before we started really diving into it. But I will tell you, it was a very positive meeting, and they understand where we are at, and they understand the needs of what we need to sustain this healthcare plan.
I think the biggest takeaway from that meeting too that Mike and I got is, we actively starting December, January, February, we've actively got to try to come up with some better recommendations that are gonna, of course, we didn't anticipate that, and I think they understand that. I think that's why they're so open to us doing this, because nobody anticipated what was gonna happen with COVID, but trying to figure out how we can better make this plan viable in the future. And one of the things kind of coming out of that too, and I'm not opposed to looking at this because we know the OAP2 is staying in the positive. And the more people that go to that plan, the better it's going to be for the overall plan. So they're even thinking that, like, when we do a future increase to kind of encourage, we're too late to do any of that right now. But when we do a future increase to not raise the OAP2, so that plan looks better, or we figure out if we can put more funding in the money that they get every year to make it better for people to want to go to it. So it's how do we improve that OAP2 since it's not going in the hole? How do we get people to kind of leave OAP1 and go over there? Because right now it's the healthiest part of our whole plan. So those are things that they're really intent on looking at. Yeah.
And the other thing too, the other big positive that I brought out of that meeting on Monday is that, we talked to them about the pharmacy changes that we've made, and that we had Cigna look into that, because traditionally our pharmacy side has always been the hardest hit. And we informed that, we did those 3 plans that we implemented, and the committee made recommendations on last month to send to the city manager's office, that those were cost-free, and that's every plan that Cigna has out there to help us with the pharmacy side of it. So they were encouraged that they know that we're working hard. They know that we're trying to find solutions to this. So I think that helped with them being a little bit more optimistic and open to looking at some type of premium or influx of cash into this plan.
Well, do we move for more discussion, or do we move for a vote?
I think we need a motion.
I think at this time we're going to have to, I think we're getting down to the end of the year. I think we need some type of recommendation from this committee to take to the city manager and figure out what's going to be the best interest. And I think that's one of the reasons that Cindy and I and a couple others have talked about, I agree with Terry. I don't want to jump to the 10 or 20%. I think that is extreme. I think we just need to be conservative with this, make a small influx to get us by, to give us more time to look at the data as the numbers come in and kind of look at our plan options. I don't want to get to the point where we're just we're jumping from one extreme to the other. I think that this committee can handle the burden of looking into that, and that's my opinion.
I'll make a motion. I'll make a motion that we increase the plan funding by 5%.
I'll second.
Motion was made by Cindy, seconded by Jamie to increase the plan funding by 5%. All in favor, say aye. Aye. Anybody opposed? Motion approved.
And this would be for the January 1st date, and we'd have to wait 2 weeks to see if council approves. Or
I think
guess
it's
the
something that we kind of leave it open at this time and see what's going to work best, because we have to remember too that any type of increase that we do, we have to get that communication piece out. We're going through open enrollment right now. We discussed maybe postponing open enrollment, and it was my understanding from HR that to do that would be monumental. It would be almost impossible to do. So I think if we kind of leave this open-ended a little bit, it gives us a little bit of time to get that communication piece out and relay to everybody and all the employees and plan members that this is what we need to do.
Well, and like Terry pointed out, I definitely think then the paperwork should promote the idea of what the money cost is and not what the premium increase is. So each one of the plans, whether it's single, spouse, employee, child, family, whatever, that the increase is represented by a hard number and not a 5% increase.
Absolutely. I agree with you on that, that we need to show the hard numbers and people need to know what to expect. It's not just, oh, your plan's going up 5%.
That's boost.
And it's like Terry said earlier, 5% that's a drastic, it sounds like a drastic amount because not everybody understands what that actual 20% looks like. And that's something that we'll work with HR and city administration on to make sure that we show them hard numbers of what that increase is going to be.
Well, look how drastic it was when the city was telling all its employees are getting 1%. Employees freaked out. I know people are struggling right now, and even with this COVID thing, it's made twice as hard. So something has to change.
Okay, we'll continue on to. We'll continue on to new business. The other thing that was discussed last week in our special meeting that wasn't broadcasted was the Cigna update on dental premiums. I'd kind of like to remind everybody that this is a fully funded plan. Staywell is not involved in this. It's not a self-insured premium plan like our medical side is. So this is coming from Cigna. I wanted to get this out to everybody that way that they understood that we could communicate this to the rest of the members on the plan. Julie, if you could.
Sure thing. So, we have, you all have had a 2-year rate guarantee on the dental plans, and that ends at the end of this calendar year. So, you have a new 2-year rate guarantee starting 1/1/21 that goes through the end of 22. It's a 5.96% increase. And, we also want to just remind you guys that we did give a fee holiday of about $73,000 for 1 month premium, and that was shared with the city. So the reason for the increase in the dental premiums, we saw, during the shutdown, we could see some decrease in dental costs, but that came back. So that's the reason for the 5.96 increase. That'll be flat for 2 years, like I said. And I believe the city did share that dental premium holiday with the employees, and that was about $73,000.
So just to reiterate on kind of what we're talking about, when they talk about a 5.96% increase, when you break that down for the employee only, it's $1.60.
Right. Right. And Mike, if I could just mention something, I did look up Blue Springs IV, they don't have a clinic, so that's why we didn't include them.
Sounds good. Thank you for doing that.
Least Summit does have a clinic, so they are included, and of course you got Independence, but, Blue Springs currently does not have a clinic in the Hy-Vee. So I just actually fact checked that, to be sure, but just wanted to share that with the group.
On that dental plan, how much was the family gonna increase on that 5.9% dollar amount? I don't have that in front of me.
That would be, Julie, do you have that figure?
I will find it here in just a second.
While you look for that, Dina, you mentioned earlier something about the reinsurance. I know we went up, was it last year? This last year we went up to the 275 from the 250. You mentioned something about an increase on that. I thought when we raised that, the reason why we signed on that was a guaranteed premium for that reinsurance for 3 years. Am I wrong on that? Did I see that the city's getting ready to vote on that again?
Yeah, there's no guarantee on reinsurance ever. So the guarantees are on the admin side, not on the reinsurance side. That's an annual marketing effort. The reason you went up to it, the reason you increased was because the savings, on the fixed fees were anticipated to be much greater than the additional liability between 250 and 275. And that has played true because you don't have anyone that has breached that stop loss at all yet this year, right? So you saved premium dollars by increasing it, and you haven't spent any additional dollars.
So I have the dental. Sorry, go ahead, Dina. Didn't mean to interrupt you.
That's okay. I just want to make sure that you're following me on that one.
I got you.
Okay.
So on the dental, the employee only, and this is on the base plan. So as Mike said, $1.60 on employee only. Employee plus one is $3.44. And then employee plus two or more is $5.11 monthly.
Okay, Mike, so what I was trying to say is we're gonna need to do a motion on that stop loss because that has to go to council. Dina, when's that take effect? January 1?
Should.
Yes, this is for January 1.
Yeah, so we've gotta get that motion so that goes before council. We're always in the same boat.
Yep.
Getting it in here, but we gotta have that go before council on that stop loss.
Well, Dina, I'll turn it over to you and let you do your presentation on the stop loss and kind of go into the details of that, and we'll go from there as a committee.
Let me re-pull it up. So did you get that one, Mike? That one came yesterday, I think.
I don't think I received that one, no.
I mean,
Sandra,
sure.
nothing.
Oh, shoot. Yeah, it was delivered, darn it.
Okay, so I will go over at my level then, because obviously you don't have the copies in front of you. But basically over the past, in 2018 and 2019, your loss ratio was 95%, which means that for every dollar you paid in, Cigna paid out 95 cents in stop loss reimbursements. Obviously, their desired loss ratio is just a tad bit higher than that. So in looking at the stop loss, they look at that historical, they look at future potential large claimants, they look at market conditions, a lot of different factors. So far this year, you actually have one breach. So I was trying to look that up back to Mike's question. So So you have spent an additional 25,000 over what you would have if you had kept it at 250,000 for 2020. But if you have one breach that's at 290,000 basically is the claimant. But your loss ratio today is very small because they have only reimbursed a very small amount. The next thing that we kind of look at is the top 5 claimants. And as I shared, your largest claimant is no longer on the plan. That individual has passed away. And the other claimants are not anticipated to be significant for 2021. They did go to the market and had quotes provided from Cigna, which is firm, Symetra, Sun Life, Voya, Anthem, and HM, which are not firm. The Cigna's proposal per proposal is less than the illustrative marketing from all the other carriers. Berkeley, ISU, Liberty Mutual, Optum, QBE, and HCC all declined to quote because they were uncompetitive or there were things within the historical claims that concern them. When they say they're uncompetitive, that means they just look at your demographics and say, what would we rate you without looking at the underlying health risk? And if that is higher than, a higher starting point, they know that they're not going to be competitive and then they pass on the proposal. Part of that is, the fact that you have police and fire and some of those little higher risk professions, and not all surplus carriers feel comfortable in that marketplace. So Cigna is at 13.6% over current for specific. And let's see, where is it? Sorry, I'm kind of all over the board here because I didn't pull up the right proposal. And that is for a 275,000 specific. It does include a maximum of an increase for 2022 of 45% and no new lasers at renewal. This is without any lasers on the plan, so there's not any individuals that would be over that 275,000. And that's part of the stop loss contracts that Lockton regularly recommends and seeks from the market. So basically, your cost would be going up from $99.31 per employee per month to $113.34 per employee per month for the specific, and from $6.22 per employee per month to $6.53 for aggregate. Aggregate is the coverage that says that if your claims exceed 125% of Cigna's expectations, then they will cover the next $1 million. Overall, on the other side of the house, I was trying to see if the composite factors have decreased from 2020 to 2021. So what they're saying is they think your plan is going to decrease in pricing from 2020 to 2021, which lowers that aggregate corridor. We did look at increasing the specific to 300 and 325,000. And the cost benefit of doing that. And the scenarios, the 325,000 does win. You save about 92,000. No, is that right? Trying to see what that number is.
I've got it, Dean. I'm trying to look and see.
You would save 120,000 by moving to a 325,000 specific, but then you would open yourself up for an additional 50,000 liability on the large claimants. So it's a risk reward situation that you would have to evaluate. And that's what we evaluated last year by moving from 250 to 275 is that you opened yourself up on $25,000 of additional liability on an individual basis, but we're able to save some significant fixed cost dollars. So I apologize, you don't have the presentation in front of you. That's kind of the nuts and bolts of it.
Dina, real quick, just what's the overall cost of our specific stop loss for 2021 if we stay at the $275,000 specific?
It would be this page.
90, I'm showing 90,271.
Per month. No, that's aggregate, Amber. Your specific would be 1,566,812. Your aggregate would be 90,271. For total fixed cost of 1,657,083.
Okay.
1,657,083. Which is an increase of 198,236 over current.
Can you guys email that out to the committee? That present?
Yes.
Okay,
Yes.
thank you.
And I think you should have copies at the fire station, Mike. Sorry that they didn't get to you though.
Oh, that's okay. So we probably need a motion on stop loss, so, because it's gonna have to go in front of council to go live January 1. I know this is kind of a bad spot to put us in, not having the presentation in front of us.
The offer is firm until December 1st, and I can't speak for Julie, but my guess is they would extend it for council approval if the recommendation of the committee is received by December 1st. Julie, you can speak for yourself now. I put those words in your mouth.
I can certainly request an extension. I would think that I ought to be able to sweet talk somebody into it, but no pressure.
Is that something we'd feel more comfortable with looking at the actual presentation? I will say, on that note, we are meeting earlier next month because of the Thanksgiving holiday. We're meeting on the third Wednesday of the month instead of the fourth Wednesday. So that might help speed up the process of getting it in front of council as well.
Well, I don't think Lockens steered us too wrong on all of this. I think that the 275, taking on the 25,000 extra instead of the 50, that it would be what the way claims are going right now. I think is the smart way to go, even if there's a premium increase. What's anybody else's opinion?
I agree.
I'd be willing, and if anything, I'll make a motion that we accept the Cigna offer for the 275 stop loss for the next 2021 year. I mean, do we suggest that part on the motion part? Do we do the recommendations to help the council make decisions on this? All right, I definitely say we have I make a motion that we keep the stop loss at $275,000 for 2021.
It'll be 21.
21, right? Didn't I say 2021?
Oh, yeah, sorry.
Mike Lever made a motion to accept the Cigna offer of stop loss to keep the specific at $275,000 for the 2021 calendar year. Do we have a second?
I second the motion.
Motion's been seconded by Terry Dorman. All in favor, say aye.
Aye.
Anybody opposed? Motion approved. I will get that to the city manager, and that way we get that on the council's agenda for approval.
I just think it's a smarter way to go because this was our first year and look at the kind of year we've had. Don't think it was normal.
I apologize, my mic wasn't on, just so everybody knows that motion did approve. We'll get that to the city manager to move forward to getting it on the city council agenda. Does anybody else have any new business they'd like to discuss? I have a motion.
Yes, I have one. I have one. This would be for Terry. Have we have we had any backfeed on the Hy-Vee stuff replacing the clinic?
I haven't,
I mean, we had 2,400 visits supposedly to the clinic. Are we on our way to having that kind of visitation at Hy-Vee?
I haven't seen the numbers on that. Does Cigna have anything on that? Julie?
So it started September the 1st, so, we don't have anything yet, but I will request that we pull data and see what kind of utilization we're seeing.
Yeah, I'd like to see how the numbers go and progress. If anything for this last quarter of the year and then also starting next year, since it is a new program.
Sure. Makes sense.
I still don't think that we've advertised that very well. Cause I know a lot of people still, so. I mean,
Cigna did a mailing to all the members of the flyer of the locations for Hy-Vee. And we did put it in the open enrollment guide
okay.
for,
When you're going in the open enrollment part.
it's in the open enrollment guide and it's like a what's new for 2021. I did put that as a what's new item. But it's my understanding that the Medicare retirees, they're not eligible for that program still, right?
No, they're no longer under this plan, and so they've got their own
Right.
health insurance, but
So it wasn't in their guide, but it was in the retiree guide that was mailed to all the retirees.
Does anyone else have any new business? Okay. Just a reminder, our next meeting is going to be held on Wednesday, November 18th. That is a Wednesday. I believe that is actually the third Wednesday of the month that we moved it up because of the holiday. Yeah, it'll be the third Wednesday. I'll keep the committee up to date on what happens from here on out when we meet with city admin. That way we can get this information out to the employees and the members as soon as we possibly can and go from there. So, we have a motion to adjourn.
Motion.
Jeff makes the motion to adjourn, seconded by Mike Weaver. All in favor, say aye. All opposed? Meeting is adjourned. Thank you, Dina and Amber and Julie and everyone on our team. Thank you for virtual and in force, and we'll be in contact with you. Thank you.